It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night. These healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, and welcome back for another edition of Best Docs Network. This is the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. We're going to get today's show started with wellness and functional medicine physician, Dr. Sakina Davis.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia. And the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Can I, once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
I had the four front teeth were very crooked. 2 were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me. So I did some research. I don't know if there's cosmetic dentistry up there. I'm sure there are, but I just didn't investigate it. But I did investigate this one and thought, well, this looks like a good as any. And so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio. So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. So he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps on the process because I live so far away. but very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works. I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, hell, that's funny, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family and my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Did you know that you can request an appointment with any of our amazing physicians you've seen on our show today? Just head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's interventional cardiologist, Dr. Annie Varughese.
Doctors on the military post couldn't tell me exactly what it was. So I was being treated for pneumonia. Then eventually I moved here to Houston. And that's when I met Dr. Varughese, and she diagnosed it as enlarged heart.
Stephen Jones, a wonderful man, developed cardiomyopathy, a weakness of the heart. And cardiomyopathies can occur because of coronary artery disease, blockage of the vessels that feed the heart. Can happen from viral illness that can attack the heart, and many other metabolic derangements can cause problems with the heart, the pumping of the heart. What he had was a problem with the muscle, and we were able to change that by sending him to Texas Heart Institute at the appropriate time in order to get a device that could help the pumping mechanism of the heart.
Last year, I had a heart pump put in. And I've been living off of that right now for the last year and a half.
Left ventricular assist device, and they come in different types, as we've talked about with several doctors at Texas Heart Institute, including Dr. Frazier and Dr. Delgado that we've shown on the show before. But here's a real live patient that we had from our practice, that was able to benefit from that technology.
I thank Annie Varughese a lot. She's been truthful, she's been up front. She let me know, even though she told me some things that I didn't want to hear, but and by her acting aggressively on this, it has saved me. And I would say I devote a lot to her.
Well, it used to be a bridge to transplant, that it was only a small amount of time that they had to wait, but now they can use that as their heart, basically, for a long time. And it's just because they've gotten smaller and better and safer.
Be sure to wash your sheets and other bedding in hot water that is at least 140 degrees Fahrenheit to properly sanitize and remove dust mites that can irritate sensitive skin and exacerbate eczema.
When we get sick, it's nice to know when you're contagious so you don't make other people sick. Well, there is a problem with this in that some infections, specifically viral infections, will make you contagious before you even know you're sick. For example, in influenza, you're contagious for about 36 hours before you get your first symptom. That's a bad thing, and that's why it spreads so well. With pink eye, you're contagious a day or so before you get your red, pussy-looking eyes, and you're contagious for about a day after they start getting better. So it's important to know when you're contagious, and the main way to figure that out is fever. If you have fever, you're definitely contagious in most cases. If you have a virus infection, those are very contagious. Bacterial infections are not so contagious. So if you're coughing up clear mucus or blowing out clear mucus or coughing a dry cough, that tends to be a virus and you're contagious more so than if you're coughing up thick, ugly, green, yellow stuff, which generally is a bacteria. And remember, bacteria are not quite as contagious. So, fever means you're contagious. When you get sick, it means you've probably been contagious for 24 hours already, and you're usually contagious for about 12 hours after your fever goes away. At that point, it's safe to go back to school or work.
For additional medical minutes with Dr. Honaker, head to our website, bestdocsnetwork.com, click on Education and the Medical Minute tab.
For numerous years, I've had varicose veins. I'm a registered nurse, and so I have been on my feet for 20 years, and also heredity has played into that. And so just a lot of varicosities and some pain, aching if I've been standing on my feet for a long period of time, and then just unsightliness.
Varicose veins are a symptom. They're a sign of an underlying disease or abnormality in the venous circulation. In your legs, there is no heart to pump the used blood back up, and so the pumps are your muscles. And when the veins become too large and one-way check valves have failed, now all the pumping doesn't work and the blood pools in the legs. It creates high pressure, which results in bulging, enlarged veins that we call varicose veins.
My dermatologist recommended Dr. Morgan, and he was very forthcoming with information. It wasn't a lot of extraneous things that I didn't understand. It was very to the point, you know, exactly what he could do for me and what the benefits, what the side effects, and it gave me an opportunity to just weigh the pros and cons of whether I wanted to go forward.
The treatment is to close all the veins that are running backwards. Any vein that is not pumping up out of the leg is only hurting, it doesn't help. And so by removing or closing those veins, you restore the circulation out of the legs back to normal.
The procedure itself probably took 30 to 45 minutes. I was able to get up off the procedure table right afterwards and walk. I did have improvement in cosmetically, which is a wonderful side benefit, but I also have decreased swelling, decreased aching. Really, it's very minimal.
She got a great result. Her swelling has gone away completely, her pain has gone away completely, and her varicose veins have gone away completely as well.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. For those of you out there who are looking for options for weight loss, our next physician may be able to help. It's bariatric surgeon, Dr. Robert Marvin.
The gastric sleeve or laparoscopic sleeve gastrectomy is a weight loss operation, which means we make little incisions, do the operation on the inside with a camera. Physically is a tapering of the stomach down from a big bag that will hold lots of food to a skinny tube that won't hold as much food.
My health was deteriorating. I was so big. I was just having such a problem. I was up over 500 pounds, and I tried to do this, I tried to do that, go to the gym, do this, and those bad eating habits would always come back.
An ideal patient would be someone with a body mass index over 35. About 5% of the population in the United States is morbidly obese.
It got to the point where I wouldn't go eat with my buddies. My guys would be like, hey, let's go eat. And I was so embarrassed to wear the uniform and be that big for people to look and go, wow, you know, what's that guy gonna do? And it embarrassed me.
Officer Schultz was super obese. His body mass index was about 71. At 553 pounds, I think he was before the surgery. Statistically speaking, there's virtually no chance he would live to a normal life expectancy at that weight.
I went in weighing 554, and I remember watching the pounds from there. And for that first week, I want to say I lost like 29 pounds that first week, and I was like, wow, here we go. And it was just a steady decrease after that. I had to go through so many uniforms over that year, because I want to say the first year I lost about 150, 180 pounds, somewhere in there.
With the sleeve operation, he's lost over 300 pounds, I believe. So his extra body weight had decreased over 3/4. That put him in a much safer body mass index, and he can expect not to develop some of those medical problems or not have them progress that we would otherwise anticipate with him. And I think he's looking at living more of a normal life than he did before.
If you're going to do the surgery, have the right mind frame. Go in there, do it for the right reason, and use it as the jump. And it'll work. It's worked flawlessly for me. I feel healthy. I'm able to run down bad guys. So, I feel like a police officer again.
Experts say weight training should be done first because it's a higher intensity exercise compared to cardio. Your body is better able to handle weight training early on in the workout because you're fresh and you have the energy you need to work out.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, we inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
For more information on some of the best doctors in the Houston area and to watch other life-changing stories, log on to bestdocsnetwork.com.
First started having some pain in my right foot after an incident stepping out of a pool, and I thought it was just a simple bone bruise, but then I had some numbness, and so I went to see some podiatrists, and initially they felt it was related to my diabetes.
When he came into my office, he complained of shooting pain in his toes. So after doing an examination, an ultrasound exam, and then he exhibited signs of a neuroma. A neuroma is essentially a nerve that is compressed by the sides of the metatarsal. So the nerve courses in between, and with a neuroma, it becomes inflamed. And after a while, it develops like a fibrous sheath, and it's no longer just inflamed, it's enlarged.
In terms of quality of life, I'm a big golfer, and it was really made every day, and certainly the enjoyment of playing golf a lot less enjoyable because of the problem.
So Mr. Weber came in with the symptoms of a neuroma, and I believe I treated him a couple times with sclerosing injections. Orthotics were given to him, and as well as instructions on stretching and taking an anti-inflammatory. And he just didn't get better. So at that point, he elected to have surgery.
Well, I think certainly in my case as a diabetic, and given that the symptoms are so similar, that this could happen to other people. I wasn't even aware of what a neuroma was, and being a diabetic. So I think just awareness is a key to understanding that numbness doesn't always mean diabetic neuropathy, and it could be an actual injury to your foot, and you should see a podiatrist.
The procedure, it's very rewarding because patients like it, and there's minimal pain postoperatively. If anything, there's some temporary numbness, and then after a while, patients regain sensation.
My experience with Dr. Maislos, what I like about him is he is very circumspect. So he doesn't assume anything. Let's go through all the steps. He's really interested in finding a solution. Very pleased with the care that the doctor has given me.
If you have a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Up next, we're going to introduce you to plastic surgeon, Dr. David Altamira.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that it bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you can always do more, but let's do something modest for now. And just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing it's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within just that day. I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine. I
think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
That's going to do it for today's episode of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are making a difference in people's lives. If you have a question or comment, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thanks again for tuning in, and I'll see you next week.